Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey Wells, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Everybody, and welcome to today's podcast. We're going to be talking about reinventing the rural hospital revenue model during COVID, telehealth and ER in rural areas, brought to you by One Touch Telehealth. We have a great guest with us today. We have Ashley Williams. She's the CEO of Innova Emergency Medical Associates and has over 20 years experience in healthcare. She was recently named Women to Watch by ColoradoBiz magazine of her local contributions in the Colorado community. Ashley, welcome to the show.
Thank you. I appreciate you having me, Carrie.
Awesome. Well, today we're going to be talking about a subject that we've heard a lot about. Really, rural hospitals around the country have just been really overwhelmed trying to keep their employees safe. During the pandemic, trying to really deal with the increase in high acuity patients, having a reduction in people coming into the ERs for, kind of low acuity type things that you would typically go. While elective surgeries are back, it's still reduced in a lot of areas. And so today we're going to be talking about really, what can rural hospital executives do to really combat this? Are there additional revenue opportunities for them really stay afloat during these times? And so with all of that kind of going on, you're kind of on the front lines on the ER side and working with rural hospitals. What are creative ways you're seeing, Ashley, that some of these rural hospitals are doing to try to make up some of this revenue and not really be as financial stressed as the market is talking about?
Absolutely. And you bring up some really good points. You're right. So the census has dropped and continues to kind of stay there. We sort of anticipated that the census would increase, but it hasn't. And so at some of our sites, we're seeing still a decrease of about 35% at some of the places that are struck more than most. But you're right. That is being mitigated a little bit by higher acuity and critical care. So the people that we're seeing are a lot sicker, right? And so, also PPP and CARES Act and all of that has been a true lifesaver for us. Honestly, rather than increasing revenue, which is certainly something people are doing, the most effective and efficient way and most immediate way to affect the bottom line is to cut staffing, unfortunately. And so we're seeing a lot of that. We're seeing a lot of hours being cut, a lot of positions being cut, things like that. But as far as ways to increase revenue, what we've seen is a lot of pop-up clinics. So we're seeing a lot of vaccine clinics, a lot of respiratory clinics, things like that. So sort of creative ways to kind of not only bring people in, but kind of, segment out the COVID people and keep them safe and take extra measures that need to be taken in order to keep that population safe. Another thing that we're seeing is maybe executives bringing in specialty services, things that they didn't do before. And so, for instance, we have one hospital where they're bringing gastroenterologists to come do scopes a few times a week. And that's not something that they ever did before, but it's a new revenue stream for them. And then, telehealth is a big thing. People are really relying on that as well.
Yeah, and there was I don't know if you've seen it, but a report came out yesterday for the U.S. Government Accountability Office saying that 25% of rural hospitals are in financial distress and on the brink of closure, which obviously has a trickle effect of these local communities that may be the only rural hospital within an hour and a half, 2 hours.
Absolutely.
As we've seen with the pandemic, telehealth kind of put the industry, 18 months, maybe even more in advance. How are you seeing, whether it's ER or rural hospitals utilizing telehealth, and how would, if we're on the brink of losing 25% of these rural hospitals, how does telehealth even become more of a play in these local areas that they may be on the brink of closure?
Right. So you're right. So, 1 in 5 Americans live in a rural community, and it's the place where It's just really hard to recruit physicians and kind of maintain these facilities. And so telehealth is a great avenue that people can take, that hospitals can take. Teleneuro is a big one that we've seen pop up. It's hospital dependent, but in Colorado, some of the big teleneuro practices were developed here or started here. And so that's a big one, particularly in Colorado. It's interesting, telepsych outpatient at almost all the hospitals that we work, almost all the outpatient psych is tele, almost all of it is. And it's really kind of making that swing. It's really difficult to get really good psychiatric care in small communities. It's just a huge challenge, but we've seen that really work well. We've seen that be a good way to get care to patients that really need it. We've seen an interesting thing is telehospitalists, which is interesting because we'll have, as the emergency medicine physicians, we will see patients be admitted, stay for several days, and then be discharged. And the only physician that they ever actually see in person will be the emergency medicine provider, because sometimes they're the only people in the whole hospital, especially at nights. But it actually works really well in some circumstances, because the telehealth physicians are available 24/7. They're eager. They're engaged. So as long as you have somebody on site who can really handle emergencies, then that model works really well. You have to have a strong emergency department in order to make that well, because you want, in case somebody crashes or crumps, you want to be able to have somebody there. Telenephrology is an interesting one. So something that, used to be when somebody needed dialysis, they had to drive many hours to a big center to get that care. And now, as long as you have a nephrology nurse, dialysis nurse, and then you have somebody who can, again, put in a central line, as long as you can do that, then those patients can stay in their communities, which is really, really important, I think, because nobody wants to travel 3 hours for dialysis. And one that has really directly been impacted by COVID is we've seen a lot of telecritical care and tele-ICU. And so what's happening is, as with the first topic that we talked about, is that a lot of these smaller hospitals, they've put in beds, they've put in negative pressure rooms, they've put in all these things. So they feel more comfortable keeping higher acuity patients, where in the past we may have shipped them to a larger center. Now they're able to keep them, and they're able to care for them because they have these measures in place, which has been really good financially, and also just for the patients in the community.
Yeah, that's great. We've seen we're pretty big. One Touch Telehealth's pretty large in nephrology, and we've seen such a surge in that, especially in these rural areas that you may, only have one dialysis unit, and nephrologists spend so much time making rounds that really saved a lot there.
Yeah, and most of our sites don't have them at all. They don't have any. So
yeah, and the other one we're seeing pretty big where rural hospitals are playing is, them really working closely with long-term care, senior living, skilled nursing, that they may only have a physician that comes on, or a chief medical officer, a couple of days a week, and they're really able to provide kind of faster response than, waiting till Tuesday till the doctor makes the rounds, and trying to reduce the transport, especially with elderly patients that, could be really, fatal if they got COVID. So I think we'll see, some of that continued in kind of a hybrid model, which will be interesting. Which goes to my next kind of question. You work a ton with, Innova works a ton with rural hospital administrators, and really as folks are trying to prioritize during this new time of kind of what's staying, what's going, what's a new normal, what should be on the roadmap in 2021 that hospital administrators should be looking at?
That's a great question. And, I can't speak to the hospital as a whole, but I can speak to my perspective, which is through the emergency department. And I can try and break out that crystal ball. We've been staring at it for a long time, trying to figure out, at the beginning of COVID, trying to figure out what this beast was going to do. And then now we are starting to figure out the pieces. And so I think that's a good question. And so one, as I mentioned before, I think there is a trend towards telehealth. And I think that in doing that, you do need a strong emergency department. I think that it's critical that you have somebody there who can handle the emergencies as you add in all these virtual physicians. It's the backbone of the hospital, and I think that needs to be really, really strong. Another thing is supply chain. it really elucidated all the gaps in the supply chain once COVID hit. You got to see a lot of our sites, they only had one vendor for supplies. And when that vendor ran out of things during COVID, then, everybody was, stuck, and they were put in a really difficult situation. So my recommendation would be to establish multiple relationships with multiple vendors.
Yeah.
And so that they aren't victim to that again, right? So during COVID, when it first hit, a lot of our hospitals couldn't find supplies, whether it was hand sanitizer or PPE or whatever it was. They couldn't find it, needles to do the COVID, or swabs to do the COVID test, anything. They couldn't find them. And so we were finding them on eBay and Craigslist. I mean, we were thinking as far out of the box as we could. We're going to nail salons and paint stores, just really anywhere. I was literally meeting people on the side of the road, because they happened to have a box in their basement that they hadn't touched in a while, and they were willing generously to donate it to us. So just really be creative. When it comes to that, a lot of people threw up their hands. We're like, well, we can't get it. Our vendor doesn't have it. And so create those relationships now, keep them strong. And then also particularly for hospitals that aren't part of a larger hospital system, which most of ours aren't, I think it's really important that you build strong relationships with similar hospitals, whether it's in your area or whatever it is. They're the same size, something that binds you together. We've seen some of them join and even create these sort of consortiums. It's a great repository for idea sharing. So you're not reinventing the wheel when something comes up, or there's also just, there's power in numbers, whether it's lobbying for this or that, or if it's in purchasing, it's important, I think, to establish those relationships, just so you're not by yourself. So you can call another CEO up and say, oh, what did you do in this situation? Are you guys seeing this? Is this what's going on? So I think that is important. And then I guess the last thing I would focus on would be, even the best billing and coding departments are letting things slip through the cracks. There's just so much data that it flows through that department on a daily basis. And what we found is that you can make really big impacts by making really small change. And so I would really encourage you to go back and look at something simple, critical care. Look at your critical care, find out what your state averages are, benchmark, find out if you're hitting them. Odds are you're not. And even just subtle changes in how the billing and coding is happening can mean huge impacts on your bottom line. So that's just a few things.
Yeah, I think the RCM side, there's always money. It seems like everybody's leaving money on the table.
It's hard. And, physicians get in the practice of, they don't do their own, at least in our practice, they don't do billing and coding. They don't code their charts, but I want them to document for what they do. I want to make sure that it's in the charts, and their goal is to see patients, but that it also needs to be to make sure it's documented, because we don't want things going on in the emergency department that are being done and then just not being paid for. So it's important.
Yeah. So I want to go back to something you said earlier, which I think is really critical. A lot of times rural hospitals look at, the loss in revenue and the decline for not having that low acuity. And as you said, there's cutting of staff, and that's obviously, hard, especially in these rural areas.
It sure is.
For this, the people and the employees and things like that. But as we look at the operational efficiency side, I think a lot of people, whether it's, anything across the hospital or even telehealth, a lot of people just think about revenue and billable codes and not think about the efficiencies of, if I could see, 3 patients via telehealth versus 1 in person, the efficiency side of things. And I'm sure there's a million things in rural hospitals in the ER that efficiencies. Are there any things that stick out from you from an operational efficiency standpoint, that if they're not able to increase the revenue, but at least, from an efficiency standpoint, if it, saves a couple FTEs or heads or whatever it may be, are there any things that you're seeing efficiency wise?
We spend a lot of time looking at metrics. We're sort of metrics driven, and the things that as far as efficiency are concerned would be getting patients back, your door to doc times, as far as, because it's all a domino effect. If you can see the patients and get them in quickly and decrease their length of stays, and patient satisfaction goes up, and then the word just goes out in the community and you can see more patients, and it affects revenue. And so it's just about vigilance. It's just making sure that that you see the patients efficiently, and you spend a quality time with them, but then you're also, like you said, just really effective and efficient with your time. And it's hard because people get complacent, they get back and it's hard to keep that pace up,
Right.
a lot. But I think it takes really having the physicians work hand in hand with the nursing staff to make sure that there's a common goal, and that's to treat the patients well and treat them quickly.
Yeah.
And so, because nobody wants to be stuck in an emergency department for 4 hours, right? So, it is important, I think, that it is a direct satisfier for patients for sure to get them in, get them quickly, and then, like you said, it affects the bottom line too.
Yeah, great.
There's a drop in love without being seen, because eventually, you have patients that just will leave, and we don't want that. We want them to be treated. We want them to be taken care of, and so.
Yeah, definitely. And the last one is really, what can hospitals, rural hospitals, do to keep, I think we've talked about this a lot, and then it kind of went a little bit by the wayside, but really keeping employees, patients, and the community safe during the pandemic. I know numbers are coming down, we've got vaccines circulating, but we're not completely out of the woods here. So I think the safety part of it sometimes goes by, things secondarily to what it was when we started the pandemic.
Yeah, absolutely. And that's another great question. So, I mean, the first thing, I hate to harp on it, but you need to be able to have people in your community know that they can be treated if something goes horribly wrong. And so rather than being able to drive many, many hours, they need to know that there is an urgent care or an emergency department or something in their community that can treat them if something goes wrong. For instance, I live in the mountains outside of Denver, and the nearest hospital is 45 minutes. And my son shattered his arm, wretchedly shattered his arm. And it was a long drive, let me tell you, to get down that hill when your kid's arm is, broken in many pieces, in many places. So just knowing that you can trust the providers that are in your community. I would make sure that there is, good PPE in the department, but not only do the providers have access to it, but that they're using it, that there's good hygiene going on in your emergency department and your hospital as a whole, right? Because there's nothing more disconcerting than going to the emergency department, which I did based on the last story, and seeing providers that aren't washing their hands or aren't modeling good behavior. And that makes the patients feel unsafe. So make sure that there's good hygiene going on in your department, in your hospital as a whole. The hospitals that have done it really, really well during this pandemic have had really strong community and educational outreach programs, because we want to make sure that people are getting their information from the hospital and from the physicians, not from Facebook or their neighbors. And so I just think it's really important that they convey a sense of calm, and they convey a sense of competence, and that they give a lot of great information about what to do in certain scenarios and where to go and things like that. So I've seen a lot of hospitals do a really, really good job. I've seen some not do a great job. And so I think that a lot of hospitals have room for improvement on that front. And then this sounds so simple, but make sure that you have vaccines for your community, and make sure that you have not only the primary vaccine, but then you have the secondary vaccine, because we've seen some communities go ahead and start that first rollout and then realize that they don't have enough for the second. And that is frightening. It's really frightening for the people in your community. So I would like I said, it sounds so simple, but just make sure that your community has access to vaccines, both doses.
Well, awesome, Ashley. It has been great to have you on the show. To learn more about Ashley or Innova, feel free to click on in the show notes to learn more there. As always, feel free to subscribe to the weekly podcast to get it delivered to you weekly on your podcast player of choice. If you have any questions about today's show or from Ashley, feel free to submit those. Ashley, thanks again so much for being on the show. It was great having you.
Thank you, Carrie. I appreciate it.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.